Patellofemoral syndrome is a very common entity. It's probably the most common overuse condition that we see in the knee. And generally people present with what we refer to as anterior knee-related pain, which is pain in the front of the knee. If we were to look at the design of the knee, there are basically three bones. There's your femur, which is your thigh bone, the tibia, which is your shin bone, and then there's the patella, which is the kneecap. So with physical activity, the patella is pulled up and down and up and down and up and down as we run. And if the kneecap stays in the middle of that groove, it's pulled up and down without any problem. If the kneecap is deviated to one side or the other, the cartilage on the back of the kneecap tends to get inflamed. The back of the kneecap is a perfectly white, smooth, shiny surface. If you look inside the knee joint, it looks like a cue ball. It's absolutely beautiful. The end of the thigh bone has that same material. In patellofemoral syndrome, people's kneecap are aligned one way or the other, so they're bearing weight primarily on one part of the kneecap than the other. So if they do a lot of repetitive activity, one part of the kneecap is working overtime and the other part of the kneecap is taking the day off. And essentially we'll start to develop an inflammation behind the patella and inflammation on the end of the thigh bone. If they have a flat foot, we'll often put them in an arch support to neutralize the alignment of the foot. More than anything, it's really a matter of retoning their quadricep. There are four muscles that control your kneecap. There's one muscle on the inside, one muscle on the outside. The muscle on the outside is generally a little bit too tight, and the muscle on the inside is a little bit weak or atrophic. If we can strengthen the muscle on the inside of the knee and work on the flexibility of the muscle on the outside of the knee, we can kind of balance that kneecap, allow that kneecap to ride in the groove that it's supposed to, and the inflammation will go away. So part of it's rehab. Acutely when they have pain, icing is important. Acutely an anti-inflammatory like Advil or ibuprofen is often helpful. But in the long term, if they want to be involved in an exercise program, it really involves balancing the mechanics of their knee, and it involves optimizing the alignment of their foot. If they continue to be active, because one part of the kneecap is bearing more weight than it should, we will see some breakdown of that articular cartilage on the back of the patella, and we will see potentially the development of arthritis down the road, where that white, smooth, shiny surface wears away. So it is important to get it treated, and not only to lead an active lifestyle, but also to prevent arthritis. In some cases we do surgical intervention. It's not common, but I would probably say 1 out of 50 or 1 out of 100 people, we might end up doing an arthroscopy and smoothing down the back of the kneecap, or we might end up doing a procedure to manually reposition the kneecap so that the kneecap will in fact stay in the middle of the groove.